Can everybody hear? All right. So we're each going to present ourselves. We want to welcome you to this early session. And a bit of interesting news. Two people who stayed till the end and who have contributed to the discussion after our presentations will walk away with one each lovely pair of socks, which you might have seen in the social media. This is called the pink socks concept. It's a guy in the US ordered thousands of these, then you buy them from him at cost and give them, it's called gifting, the way they do at a famous event called Burning Man. You gift it to somebody who is doing good in the world. Now, all 1,200 people here are doing good in the world, but we'll choose two at the end. So Andrew, do you want to present yourself?
Yeah, so thanks, Denise. My name's Andrew Stewartson. I'm an infectious diseases physician from Melbourne in Australia. I worked here in Geneva for 4 years, and a lot of that was about patient participation in hand hygiene promotion. So that's what I'll spend a little bit of time talking about before we have some discussion. But Denise is going to start.
Right. So myself, I'm Denise Silber. I'm the odd duck at this conference because I don't come to it from the infectious diseases, but from healthcare in general. I'm a digital health innovation and patient engagement communications person. So I organize events, I write, do films, anything to promote the joint use. It's very difficult to advance in patient engagement without somewhere along the line including digital tools. So we decided ladies first, and what I wanted to say to you is that I think that this sentence really summarizes well the issue of why it's important to involve patients, that there be patient-led research, because when you do the research to find out what patients are looking for from research, it's normal. It doesn't perfectly align with many usual topics of research. So patients are interested in quality of life, symptom management, the efficiency of the system, evaluation of results, and quite often you have industry with its medicines or surgeons who want to find new methods. And so you need to have research that is done from the point of view of all of the different stakeholders. There are many groups out there that use patient or promote patient-led research. This one is British, so the plrh.org in Cambridge, who partner with patient organizations to involve them in defining new forms of new studies. So that's important. There's also something called the James Lind Alliance that brings together clinicians and patients and carers. And they have a guidebook on how to find funding for research. This article will come out, I think it's dated October, October of 2019 in Elsevier. This is a very interesting question of how online communities foster innovation. From the very beginning, if you go back on Medline or PubMed, you will see that there have been questions all along, like for the past 10, 20 years. If we recruit online, are we going to be able to get a population that matches the reality? And the fact is, the further we go, the more the answer is yes, because now, with the exception of those people that don't access, but that's a smaller and smaller number, you have such a huge number of people. And as we heard at this conference, qualitative research also works. So there's no challenge to finding the people you need by going online. One other point I would make here about going online is that I noticed that a lot of your colleagues, in order to talk about social media, will go online to look at studies. And you have to be wary of this. Social media changes much faster than the publishing period. Quite often, and your colleagues will cite a study that's a few years old. So if the study was published in 2013, the people were looked at in 2012, and the internet is quite different now in terms of the users. So there is a There is a journal I wanted to recommend called JMIR. Do you know this one? Journal of Medical Internet Research. They do good stuff, and it's very recent. Some of the issues in patient-led research are the fact that there's always been this tension between what does the patient know and what happens if it doesn't match what the physician sees, because it isn't taught in medical school, or wasn't taught in medical school, that there could be someone out there who didn't go through these 10 years of preparation who could have some interesting scientific insights. That's another good study on the BMJ. So patient, in this one, I liked noting, because maybe that can be part of the discussion, patients who have in-depth knowledge of their condition encounter problems when their expertise is seen as inappropriate in standard interactions. Because as it has been said again over and over in this conference, everybody is an individual. There's no such thing as the average patient. I mean, what happens when you have one person weighing 50 and one person weighing 150? So the average one is 100 kilos. It's neither of them. And they ask these good questions. So how can we give patient-led or patient-sourced research a good position in academia? What are the proper conditions we must provide for patients when they are participating in research? I'm not just saying the ones that are being studied, but the ones that are actually sitting around the table, taking their time. And quite often, these are people whose livelihood, whose income has been interrupted. And then they're going to give the little time they have to participating in research groups. Is there some funding to recognize their contribution? And then, of course, what patients really want, a patient's life is quite different from a researcher. A researcher, how does every article practically on Medline end with, this was a really interesting study and we must pursue the research to see what more we can find or to see if it's confirmed. The patient wants to see a result and then put it into action. So I think that that should be managed. We must manage, when you do have patients in research, we must manage their expectation. So that is what I wanted to say to begin with. Andrew's going to speak, and then afterwards we're going to see how we can interact with you.
Great. Maybe we, yeah, thanks. Where'd it go? So,
Get out of it. We are both Mac people, so
we're getting there.
confronted with conference PCs.
Okay. Yeah, so my slides are focusing more on involving patients or engaging with patients to promote hand hygiene rather than research as such. And in fact, in talking to Denise about this session, it really, for me, illustrated the biases that I have cognitively in thinking about this topic, because although we did quite a large study looking at involving patients in hand hygiene promotion here in Geneva, and we based some of the design of that study on surveys and interviews that we'd done with patients. Patients weren't actually involved they weren't part of the study group as such, and that's a barrier that I, in my research, haven't really ever quite gone over. So be interested to hear about Denise's comments about that and about the experience of people in the room as well. So I'll go through these slides. I'll try and stand up, but let me know. Can you hear me still? Or is it better to sit down? It's okay? Okay, all right. So no disclosure. So this is a survey that we did a few years ago looking at patient participation in hand hygiene. We did sort of through WHO, and you can see all the countries coloured in red had some, there were at least one facility from those countries that had some sort of formal patient engagement program in hand hygiene promotion. And there were three main ways that these programs were working. The most common one was education, so some sort of education. The idea being that education of patients is a prerequisite for autonomy. And so this is a brochure as one example that we used here in Geneva. that was educating patients about their own opportunities for hand hygiene, as well as healthcare workers' opportunities for hand hygiene, thinking that there should be some sort of sharing there of knowledge about. In fact, I'll get to that later on, so I won't go into too much detail. I think Eve put this up on the opening session to educate patients about the fact that healthcare workers perform hand hygiene less frequently than they should, because there are quite a few surveys that show that patients think that healthcare workers do quite well with hand hygiene performance, and so it's an interesting thing to need to tell patients that actually we don't do so well all the time. So that was education. As I say, this will be quite brief, I hope. The second thing is reminders. Can I ask you, I won't ask yet for too much interaction, but maybe put up a hand if at your hospital or institution there's a program for asking patients to remind healthcare workers to perform hand hygiene. So certainly at my organisation we have that, but yeah, okay. So here are a couple of posters, it's okay to ask. And the idea here, I think, is to try and make sure that patients know that it's a norm, that it's expected that they will ask healthcare workers. And posters are one thing, because obviously it's quite a challenging thing to do for a patient who's in such a vulnerable position, as everyone knows, to remind healthcare workers to do something. It's quite confronting. So to try and create that environment where healthcare workers where patients feel comfortable is quite a challenge. And posters are one thing. I think even better, probably, you've probably seen the studies with the healthcare workers individually having a badge saying it's okay to ask. And again, it'd be interesting to know if you've got experience with that sort of thing. So often these sort of it's okay to ask type campaigns focus on moment one of the 5 moments, because the theory being that it's sort of easier for the patient to see healthcare workers coming towards them and to educate them about the fact that the healthcare worker should perform hand hygiene somewhere between entering the doorway and touching them, as opposed to the other moments, which can be a little bit harder potentially. And also the benefit of moment one is that often we don't do it particularly well compared to the other moments anyway. So yeah, this was a study that I've referred to that we did here in Geneva, and we put a lot of effort over a lot of years into trying to promote this activity of patient participation in hand hygiene, with the central theme really being to ask healthcare workers or remind them to perform hand hygiene. And I guess it was kind of humbling to see that after all of this work put in by many people, during the hand hygiene observations, we never saw a single patient ask a healthcare worker to perform hand hygiene. It just didn't happen. It may have happened at some point where we weren't there because we were only there for small amounts of time, but it never happened. And it's interesting to think about how this particular intervention can still be useful even in that scenario. And again, that's something that Eve touched on in the opening ceremony. Here we go. Another one, sort of just again giving a sort of an analogy of having something stuck in your teeth. About for having performed hand hygiene, you've got something stuck in your teeth. They're both awkward social situations, so to try and diffuse that a little bit. It's okay, and here's a poster from the UK showing it's okay to ask both before and after, so trying to push patients a bit further. And then this was a paper about patient engagement with surgical site infection prevention, where they were going a step further and saying, ask healthcare workers to perform hand hygiene before examining your wound. And then the third thing I wanted to just touch on briefly is the idea of patient auditors. There's just a couple of papers I mentioned briefly here, both of them set in the outpatient clinic, and I think the idea being that it's more challenging for us as healthcare workers to audit in the outpatient clinic because it's a bit of an artificial situation if you have a hand hygiene auditor standing in a consultation room with a closed door with a patient and a healthcare worker there, and also there's far fewer opportunities, so it's quite a time-consuming process. So yeah, in this particular study, the patient was given a card, asked to score whether the medical staff and nursing staff performed hand hygiene, and then dropped it off in a box on the way out. And there was comparison with a gold standard auditor as well, and found to correlate reasonably well. And this was a similar paper as well. And again, the experience was that this was practical, accurate, cost-effective, and supports this sort of engagement with patients to have patient auditors. And yeah, this is the summary from both of those papers. And thanks to Eve for this slide. Just that otherwise we might not have this data, particularly in the outpatient clinic. That there's the potential to limit auditing bias. There's a strong Hawthorne effect here. If healthcare workers know that patients are potentially auditing them, then that can improve hand hygiene compliance. And there's the potential, although this is a difficult path to navigate, of this positively impacting on the healthcare worker-patient relationship. And it certainly respects the patient's rights to be involved in their care. So I think I'm almost wrapping up, but I think my experience of these sorts of intervention is that as a sort of a culture change, a reasonably large culture change for many people, that this is something that is implemented gradually, any sort of patient involvement. You certainly have to have buy-in or stakeholder involvement from not just patients, but also from healthcare workers when you're designing this sort of program. But the potential benefit is if you can change that culture, that there's a long-lasting effect that might be stronger than the sort of thing that we see with some of our other interventions in promoting hand hygiene, if we can really get that culture change to stick. So this was a poster that we put together here again in Geneva, where we tried to show that you don't need to have everything at once. You can sort of take a stepwise approach. So the first step was, and this is for healthcare workers, not for patients, so this poster was targeting healthcare workers, that as the first step to engage with patients, you can just make sure you visibly perform hand hygiene in front of your patients. And then as a second step, once you're comfortable with that, to talk about why you're doing it. Maybe you're performing hand hygiene and say, I'm doing this to protect you, that sort of thing. And then as a third step, once you're comfortable with that, suggest that maybe you remind each other to perform hand hygiene at the appropriate times. I'll slip through these slides, but only to say that the intervention we put in place here in Geneva, it went for 2 years, and it was quite long. And what we found was that at the end of it, the healthcare workers had changed their opinion. So in fact, we went from 30% to 60% of healthcare workers thinking that it was a good idea to have patients remind healthcare workers to perform hand hygiene. So we did seem to see some change among healthcare workers. Patients, on the other hand, they're only in hospital for a few days. They're sick, unwell. They've got the difficult task here because they're the ones who are having to remind healthcare workers. The patients we found, we didn't see as bigger impact on their thought that this is a good idea. So, and we sort of speculated that's partly because we only have this very brief period of trying to educate them during a very difficult time about this confronting sort of intervention. All right, so yeah, here we go. So, and this again is sort of relatively stating the obvious, but we have this traditional dynamic of the healthcare worker being the person having a position of authority over the patient. There's this perception that the intervention of asking patients to remind healthcare workers is inverting quite rudely that association, that relationship. So the way we tried to get around that was by having a partnership where we sort of have more equality rather than someone being in a position of power over the other. We had our healthcare workers first give a gift, if you like, a sort of symbolic gift of a welcome pack to patients, which includes that leaflet that I showed earlier on, as well as a bottle of alcohol-based hand rub. And that's an opportunity to then also start a discussion about the fact that you could agree to remind each other that no one's perfect. We're both interested in the best outcome for the patient. We could remind each other to perform hand hygiene when we forget. We had some focus groups which really showed that yes, the patient reminding events happened very rarely, but there was this big impact of awareness waking, if that's a term that I can use, awareness raising, so that healthcare workers were really aware and on their toes and engaged and feeling a little bit like they had ownership more than in the traditional hand hygiene promotion situation over hand hygiene. So I think often, and we got this message through the focus groups as well, healthcare workers feel like they're on the receiving end, they're being policed and audited all the time, whereas this is a situation where they can actually take a leadership role and engage with their patients in a constructive, creative way about hand hygiene. And I'll skip through that. I've spoken for too long probably, so I'll skip through the end. And just to acknowledge a lot of people who know a lot about these sorts of things. So that was, yeah, we've still got plenty of time, which is good.
Yes.
So Denise, should I hand back over to you?
So, so how many of you here see patients to treat them versus doing research? Yeah. And how many of you are in research? And what else have I left out?
National programs and
Yeah. Okay. So you've been now, well, first of all, do you have questions for either of us, and maybe particularly for Andrew?
I guess that the University Hospital in Geneva, before you started even that study, had a long history in, hand hygiene promotion, development of multimodal strategy. So how is it? And at the same time, you say that you had awareness raising, but even patients in that hospital, which is kind of uniquely affine to this kind of strategy, do not remind. How would you explain that kind of odd discrepancy?
Yeah, so I think there's certainly a lot of awareness amongst healthcare workers. Patients, I don't know that we got, the patients are aware that it's important. I think the thing with patients was that they know that it's important, but that it's just they find it too difficult to take that leap and remind healthcare workers. It's such a hard thing to do. But the awareness raising, the experience that we had was that it was more about awareness raising amongst healthcare workers, which again, is, as you say, is sort of surprising. But it's about, I guess, making it a bit more real and adding some emotion, if you like, or making it, adding a spark of electricity when you're in that patient interaction, to think that, this patient has been invited to remind me to perform hand hygiene. And so it changes, I think it makes it slightly more dynamic to change it from, you're completely right, the healthcare workers at Geneva are well and truly saturated and aware about the importance of hand hygiene, but to have that extra thing in the back of your mind thinking that this patient who's in front of me right now has been educated about hand hygiene, I'm in a partnership with them, in a way that our experience was that the healthcare workers felt they were being empowered by, and it's a patient empowerment intervention, but healthcare workers were also being empowered and being asked to take a leadership role in hand hygiene. So I think, and to be honest, we just spent a lot of time talking about hand hygiene and patient participation. So, to a certain extent, anytime you invest time, there's going to be an impact. So, yeah, I think I guess if I was to summarize the sort of my rambling answer to you, I think it's just that it added a bit of a jolt to make it really quite real during the patient interaction.
Could you press on the button?
Oh, sorry. Yeah. Our organisation, I'm Deborah Jowett from New Zealand, and we have a national program to prevent surgical site infection, and did develop a patient information pamphlet. And while doing that, we included "It's okay to ask." In fact, it's important that healthcare workers wash their hands. We took our draft pamphlet to our patient focus groups, and their response was, "This is not our responsibility.
Yeah.
we expect healthcare workers to be professional. This is part of their role. And we're in a vulnerable situation when we've just had surgery. And no, we don't want this included in the pamphlet. So that was an interesting, we didn't anticipate that. We thought they'd be great, enthusiastic participants in the process.
Yeah. No, that's I think that's quite a common and very reasonable response. Yeah. Great.
Other questions?
Yeah, yes.
Thanks for the very nice presentations and discussion already. Our experience in the Netherlands and my university hospital is actually quite in line with this and in line with what you're saying in your experience in New Zealand. So we did a study a couple of years ago on hand hygiene and patient participation. And Andrew, we almost had the same results. So basically, yes, they said they were willing to address this problem with their physicians or nurses, but in reality, they didn't do it at all, like zero. And for me, what was interesting as well, that there was a huge differentiation between the type of patients. So younger patients, at least in the Netherlands, they were more willing, at least on paper, to address nurses and healthcare workers, while the elderly, from the very start, they said, this is not, I'm not going to do this. So I think in order to bring this further, this discussion, I think we should look closer to the type of patients actually that we want to include in these type of programs. And not, as you said, not all patients are the same. And then maybe, at least that's my take on it, we should look specifically to different type of diseases as well. So if I'm in my hematology department, where they had a stem cell transplant, they're there for 30 days or something. I think that's a nice window where you can educate your patients. However, if you're in surgery and you're in and you're out, I think it's an absolute no-go to confront them with patient participation on hand hygiene, because it's just not going to happen. So that's one. And then the other one that was my take on our own research, and a little bit the stuff that you did, Andrew, is that maybe we should take this whole patient participation on IPC and hand hygiene, take it out of the hospitals. So if you take this discussion out of the hospitals into the community already and start educational programs there, maybe again your timeline is much more favorable for a proper outcome.
Yeah. Thank you. I agree with everything that you say, and you articulated it really nicely. We ended up thinking along the same lines, and some of the patient groups we were wondering about were patients who are relatively mobile, ambulatory, but have a lot of contact with healthcare workers, and so that the outpatient group is one of those. Patients with transplants, for example. There was some discussion about a different group, and I'd be interested to know what you think about this and what everyone thinks about this, about pediatrics as well, and involving parents. And for example, in the neonatal intensive care unit, the stakes are quite high, so it's a little bit tricky. But yeah, certainly we took a reasonably blunt, in a way, approach to this, trying to think that we could apply it hospital-wide, and certainly there are probably some environments and patient groups where it would be a better place to start. Yeah, agree.
Further questions? So I was wondering if we could take 5 minutes. Unfortunately, one person left. Up until the time one person left, we had 2 by 2 everybody. I think that the woman in the white coat now would have nobody unless she can join the other 2. I would like you to, 2 by 2, each have the experience of being on either side of this question. So first, one of you, you're going to talk to each other, and then you're going to report on the experience. First, one of you is the patient speaking to the healthcare professional. You pick the scenario of where this is happening, and you've just noticed that the professional did not wash his hands or her hands, and then you finish that and do it the other way, and then people will raise their hands and report to us how they felt when they were the professional and when they were the patient. Do you agree? Mm-hmm. Okay, so I give you 4 minutes to do this.
Oh, we're going to do it too, Denise.
And we're going to do it.
Yeah.
Yes.
Excuse me. Got a frog. Almost a couple. So, shall I be the patient?
Okay.
I've come in to talk to you about a gynae procedure, a gynecological.
Okay.
Okay, so I'm feeling anxious and
Okay.
it's hard.
So it's hospital or it's outpatient?
No, maybe outpatient.
Outpatient?
Yeah.
Okay.
And you maybe you're going to put a lure in or something.
Okay.
Maybe or maybe what would I be having?
Yeah, I mean,
Yeah.
out inpatient, I think it's not really a difference for
Yeah. Okay.
Do we know each other for?
Maybe this is a repeat visit. I don't know.
Okay.
Anyway.
Because this is another thing. I mean, like, if you know your doctor 10 years, you might.
I don't know, I find it harder with my personal doctor to say anything, although he's good at
Okay.
hand hygiene. But I do find it a bit harder because I know him well now.
Okay.
I don't want to upset the relationship.
Okay.
Okay, so maybe you're a registrar and you're putting a lure in.
Okay.
Yeah. Yeah, lure, IV.
Okay. Yeah.
Maybe you're a senior doctor and you've come in to put a...
Okay. So here in the arm.
Yes,
For
or fluids or something.
okay. Okay. So what I'll do now is to get this thing going. I will put the lure into your arm so that we can infuse the therapeutic force.
Yeah.
Just let me have a look. Here's the thing, and
Yeah.
so what would happen? Okay. So
Yeah. Okay. All right. So we'll swap around.
okay.
I'm not quite sure how we do this.
Yeah, I think that's why I think what we are supposed to do is to really try and ask the provider
Oh, okay.
or remind the provider to
Yeah.
wash his or her hands.
Okay.
So,
All right. So you go to do it, and I say, "Are you going to wash your hands?"
Okay.
or whatever.
Yeah.
Like-
Has
Are you gonna clean
everyone?
your hands first?
No, there's
Yeah.
still.
So
Okay,
that's why
one more
I
minute.
Started. Okay, what I'll do
One
now
more
is
minute.
I prepare
Yeah.
the how do you call it, lure?
Oh, yeah. I'll prepare.
Prepare. How do you
L-U-E-R.
I just came
Yeah,
up with that
Leo,
idea. Hope
okay.
you like it.
Okay.
Yeah.
Okay, let's come to the discussion now.
I didn't get to you. I'm sorry. This is what I would have done.
Excuse me, let's come to the discussion now. But those hands must really be very clean. Okay. So, which group would like to speak first about how they felt in the different situations? Okay, they really want those socks.
So I think it was for us, at least for me, but I think for both, it was really intriguing because we have a clash of culture as well.
Yeah.
So you've got the Chinese culture and the Dutch culture. So Dutch in general are very blunt and ridiculously open with how they speak. And then the Chinese are probably on the other side. So I was the patient. My colleague was the nurse. So I just said, I'm sorry, my apologies, but I think you didn't, disinfect your hands properly. And then really she was shy, she was silent for a while. She said, this is really embarrassing. And it was her first reflex. I think this was just a summary of what happens.
Yeah.
So I think it was really interesting.
And the Chinese representative, your point of view? Was that a faithful representation of what you felt?
I think it depends on the request, in what way it is picked up, it asked for. I think in the Chinese culture, we prefer to make it the reminder more soft and warm, just a warm reminder. Maybe we can say, excuse me, have you cleaned your hands? I hope that this such request will be a warm reminder, and hope that the healthcare workers can be response in more happily.
Yeah,
I actually think that Chinese approach would work worldwide. Who wants to be asked brusquely? Sorry
Yeah.
for the Dutch.
I think it's really interesting the way to try and incorporate this idea of reminding hand hygiene reminders into a social situation, interaction situation that has sort of quite formal framework around it, like shaking hands, and there's ways that we greet each other, and it's hard to force this new idea into that. And we spent a bit of time thinking about that in Geneva too. So, for example, Hugo Sachs, who thinks a lot about these sorts of things and human factors design, was thinking about various ways, like perhaps the patient should offer a bottle of alcohol-based hand rub to the healthcare worker, or some sort of gesture that could, or maybe a sign that they can point to or something. It's difficult to make it smooth. Anyway, just a thought. Yeah.
Yes, so maybe on this side of the room, or at the end? Who would like to report? Yes?
So I am from Oman, and my colleague from here.
From where?
From Switzerland.
Switzerland.
Yeah. I was telling her, like, for me, it's okay. I have been admitted recently in the hospital, and I was kindly reminding my colleagues, the nurses, the doctors about it, and they were accepting it. We had no issue, but we had a group of doctors coming from other nationality in our hospital. They will be really freaked if the patient, because they think they are the most knowledgeable people, and how come the patient is reminding them? I don't know, maybe she can also express her feeling.
Yes, so being from Switzerland, I think we are, or I at least, for me it's really difficult to openly say something to people who did not do something well, and that was difficult. I in fact was also a patient once, and I saw all the people not performing hand hygiene, and even if I work in infection prevention, I never dared to tell somebody that he did not do hand hygiene. I think it's easier when you have a campaign going on, then you can refer to this campaign. That makes it easier, but for me, it was difficult to tell you not to perform hand hygiene.
So who else would like to present their experience? Tell us what scenario you set up.
Yep. You want to go ahead?
Yeah. I forgot to introduce myself. I'm Thomas von der Gerke from Germany, Nova Medical School. I think one question which was interesting for me was that when we got into a little discussion about our role play, was the question if I have the feeling that it would be easier for me to do so when I know the doctor for 10 years, like, my own physician, my own. And you said that it would be harder. So I don't know. This is kind of interesting because we also had this thing, 30 days versus only 2 days for surgery or so. So I get to know the people better. Is it easier or?
I see her point of view. It just a thought that crossed my mind. If I go to my brother's house and I say to him, "Were those dishes washed before you served me the sandwich?" It's going to be strange. So,
Yeah, I really value the relationship that I have with my general practitioner, and I don't want to do anything that would upset it. And I must mentally put asking him to wash his hands, which he's actually very good at, luckily. I must put it in that kind of bracket in my mind. Don't go there, I see it as sensitive.
Andrew, how did you feel when you were my gastroenterologist about to perform an endoscopy? Yeah. And I wanted to know, he was wearing gloves. Had he washed his hands? How does that work with the gloves?
I felt a bit embarrassed. I was about to do the gastroenteroscopy, and you in some way it was questioning my professionalism. So yeah, it was awkward. I did feel awkward about it. And you have to go through the process of taking off the gloves and performing hand hygiene. So no, it's challenging. Because I introduced the scenario by saying you know you're about to have sedation, we'll do the procedure, I'll see you after it, and then you completely derailed that process by saying that I needed to do hand hygiene. So I felt like I lost control of the situation.
Right. He was
So
about to put me to sleep, and I wanted to know about his clean hands.
yeah, it was hard. I don't know if we've quite touched on it before, but I think one thing that you know I've been not a patient, but a carer or family member of people in hospitals recently. And I find that just actually performing hand hygiene yourself is for me, was the only way that I actually managed to do it in a regular way. Most of the time, if a healthcare worker sees you performing hand hygiene, they do it too. It just sort of triggers something. So I have real experience of finding it actually quite challenging. And to some extent, I guess it depends on culture, has been mentioned, the scenario, the relationship that you have, and then also the personality of the individual person. And I'm a quiet person who doesn't like to challenge people. So I find that conversation difficult.
So you wanted to say?
May I add two thoughts? It was said, I think, from the colleague from Switzerland that a campaign helps. And my reading on this whole issue is, without the hospital, for example, really officially, you know, saying that it's okay, it won't work. So my first point is, wouldn't it be a good idea to combine such a campaign that patients ask or remind healthcare workers with a campaign that patients clean their hands, which has been an issue here too. So this would be more like we are all responsible.
Yes.
I don't know if that has been the case somewhere.
Yeah, so I didn't say it clearly, but that's what we tried to do. That it was this idea of the partnership was that the healthcare worker reminds the patients, and the patient reminds the healthcare worker.
But it didn't really.
I mean, it had some impact.
Okay.
It wasn't the complete solution, but yeah.
Couldn't it be couldn't be everybody reminding everybody? Couldn't rather than having this reminding us of the divide, patients could tell other patients and healthcare workers other healthcare workers. That would be the best. So it's really interesting, the topic that brings this conference together for all these years, where the main focus is reporting on research. And I'm wondering what it's like for you, because you come out seeing that there are so many possible interventions, and you go back, and it's so hard to move the figures to make it better. Two questions that I'd like you to comment on. One is, would you agree that this is an area where research stops and practical begins, like by doing this little dialogue, which maybe you've already done? How many of you had already done something like this before? So most of you, yeah. Do you think that that is done enough? How do you feel about the challenge of the progress, despite this massive amount of posters and research every 2 years that comes out? That's what strikes me. This is my first ICPIC. How do you come out of here motivated to keep trying when it's challenging to move the numbers, and which methods are the most efficient, the research and the practical? Please speak.
I mean, if I could start, I think it's always refreshing just to know that you're not the only one who's struggling with these issues. So to have a little bit of interactions here and hear about the fact that we're all dealing with the same issue, and have some really interesting ideas, thanks, to kind of invigorate, re-energize a little bit, is a good starting point.
Some other thoughts? Anybody who hasn't spoken? We give a grade for class participation.
I don't know how you're going to divide these socks. You have one sock each or something.
One thread each. Yeah. The lady in green, have you said anything?
No. I guess actually Australia's an interesting case for this, I think, because extremely multicultural. Sydney is probably one of the most multicultural cities in the world. And both on the patient side, I think we've got people from everywhere, and on the medical side as well, and equally, I think, probably actually over, even more multicultural on the medical and nursing side, I suspect. So I think the way I do it as a medic, as I approach patients, is very much tailored to knowing and understanding a little bit of that cultural background of the patient. So I guess that was just a comment about how I do it professionally. And I guess most of us have been patients as well. And I was in a situation where I needed a pretty urgent epidural for obvious reasons. And we just had a case that we looked after with a woman who'd had a complication with Haemophilus, meningitis post-epidural, because the anaesthetist wasn't wearing a mask. And so I didn't hesitate and just in a very, I guess a friendly manner said, we've had this really interesting case recently where actually we've shown the anaesthetists aren't always wearing masks when they should, and this poor lady ended up with meningitis. Just wondering what the standard practice in this hospital is. And so that's how I guess I pitched it as a medical patient to the doctor looking after me.
I take my hat off to you because you were in a certain condition at that moment when you calmly asked that question. You were in pain. You were in great pain. Yeah.
But I didn't hesitate because it was such a catastrophic outcome for this other patient.
Thanks. If I can reflect on that for a second, I don't think I pointed to it at the time, but I showed that we did this survey of patients to see if they would be willing to ask healthcare workers to perform hand hygiene, and exposure. I think I mentioned exposure to our intervention didn't have an impact, but the thing that did strongly have an impact was they themselves or a family member having experienced a healthcare associated infection was the only real predictor of patients being willing to perform to remind healthcare workers. Yeah.
There's a group over here. There's 3 women. One of you like to say something about the various questions?
So I'm from South Africa, and we started involving the patients about 2 years ago in performing hand hygiene. So we have a similar card that you showed. It says, please feel free to remind your healthcare worker to perform hand hygiene, and then it indicates when the patients should perform hand hygiene and then the healthcare worker on the other side. And initially what we found was that patients didn't realize that hand hygiene, you can also perform hand hygiene with alcohol. So if they had been surveyed about did your healthcare worker perform hand hygiene, and they would say no, when there was 2 questions, did they rub their hands or did they wash their hands? So they thought you only can perform hand hygiene when you wash your hands. So we first had to educate our patients on that. But I do think research is important, but I do think the practical teaching of patients and healthcare workers is more important, because what we also saw was that even though our healthcare workers were informed and educated about hand hygiene, they felt intimidated when we started involving the patients.
Okay, and this group here, the 3 gentlemen?
We were both from Sweden. My name is Jakob Sparby from Uppsala. And I had 2 different thoughts. I thought your scenario was very interesting. And we always talk about doing no harm. And if we start this kind of campaign in Uppsala, we've been working a bit with hygiene in the anesthesia area, in the operating room. And they have some problems with the compliance there. And I wouldn't want to derail my anesthesiologist just before they would put a tube in my throat. So maybe not start there, maybe start in the hematology ward. And also, well, I actually forgot the other thing.
Well, we had a complication actually, because he was the gastroenterologist referring to somebody else's work. But yes, okay. I appreciate that. Your colleague wants to say something?
No, actually not. But, but I had some thoughts about the general practitioners. You could start there as well, couldn't you? My wife is a general practitioner, and she is actually doing this, doing the hand hygiene in front of the patient and talking to the patients about the hand hygiene procedures and things like this. But I think she's the only one in our region who's doing so. But it might, I thought about your comments. It might be a good introduction for the patients to have this, because they have more contact with the general practitioners than in hospital, and then they can take it to the hospital and ask in the hospital as well.
It's a great suggestion.
Because they're used to this. I thought about a project with the general practitioners and start there, maybe.
So we have to end here because of the time. I'm going to give one pair to the Chinese representative because I learned so much from what she said. I think that it's a worldwide. Okay, thank you. And whom does the group think I should give the other? Who would like it? Who would like to explain it to you? To you? Yes? You must promise both of you to explain, to look it up because it's written pink socks. Look up the website that explains this gifting, and you must explain it back home to somebody that you won these socks. Okay. So I hope you enjoyed this session.
Thanks very much for coming and participating.